Hi, everybody. What you're about to hear is part one of two of AARP's most recent teletown halls on coronavirus. These events feature top health, policy, and finance experts who give advice, answer listeners' questions, and provide useful resources. Part two is coming soon. For up-to-date news or to participate in an upcoming town hall, go to aarp.org/coronavirus. For official health guidelines, visit cdc.gov/coronavirus. We're dedicated to providing our listeners with this information as quickly as it comes. Your health is important to us, and we hope you're all hanging in there. For an AARP Take on Today, I'm Bob Edwards. Thanks for listening, and stay safe.
Hello, I'm AARP Multicultural Lead Nicordelai Corte, and I want to welcome you to this important discussion about LGBTQ equality during the pandemic. AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being of older Americans for more than 60 years. In light of the disproportionate impact of COVID-19 on LGBTQ older adults, AARP is providing information and resources to help older adults and those caring for them. This, coupled with the ongoing issues of discrimination that has endangered the health and financial security of the LGBTQ community, has made it a particularly challenging time. At the same time, the Senate is poised to take up the Equality Act, which would extend federal civil rights laws to provide protections for LGBTQ Americans. Today, we'll hear from an impressive panel of experts about these issues and more. We have some outstanding guests joining us today, including a medical expert and leading advocates from the Human Rights Campaign, the National Center for Transgender Equality, and the Victory Institute. We will also be joined by my AARP colleague, Dr. Julie Bates, who will help facilitate your calls today. Now, I'd like to welcome our guest, Jason E. Starr, Director of Litigation for the Human Rights Campaign. Welcome, Jason.
Thank you.
Rodrigo Hang Leitinen, Deputy Executive Director of the National Center for Transgender Equality. Welcome, Rodrigo.
Thanks so much for having me.
And former Houston Mayor Anise Parker, who serves as the President and CEO of Victory Institute, a nonprofit that trains LGBTQ leaders. Welcome, Mayor Parker.
Glad to be with you once again.
Yes, this is lucky number 5. And we have Dr. Oni Blackstock, founder and executive director of Health Justice. All right, let's get started with the discussion. And just a reminder to ask your question, please press *3 on your telephone keypad, or you can drop it in the comment section on Facebook or YouTube. Let's begin with a question for all our experts about the Equality Act. Jason, we'll start with you. Can you tell us a little bit about what the Equality Act is and where does the Equality Act stand in the legislative process?
Sure. Well, again, thank you so much for this kind invitation and including the Human Rights Campaign. And hello to all of our friends at the AARP. It's so good to be with you this evening. The Equality Act is a really important landmark piece of federal civil rights legislation that will provide clear and consistent non-discrimination protections for LGBTQ people across the country. More than 20 states right now lack comprehensive non-discrimination protections in their state law for sexual orientation and or gender identity. And this means that in employment and credit and housing and education, public spaces and services, you can be in one state in our country and have really full comprehensive protections and travel to a neighboring state and not have any protections. And the same can be said for folks within a particular state, going from county to county or city to city. And so really what the Equality Act does is create a much needed update to our civil rights laws so that we not only have rights across the country, but that we know what they are and know how to vindicate them across the country. The Equality Act was first introduced in 2015, and so Congress is somewhat familiar with this legislation. It passed the House of Representatives in 2019, and just recently again in February of this year. Like you mentioned at the top of the call, Nee, we're now in the Senate, where so many others are working through that body. And really, we're out across the country talking to folks so they can talk to their elected representatives about why it's very important to have clear and consistent non-discrimination protections and really clean up this patchwork that we have across the country right now.
Thank you, Jason. Thanks for orienting us to the great importance of the Equality Act and all that it includes. Right now, I want to go to Rodrigo. Rodrigo, what will the passage of the Equality Act mean for LGBTQ adults, particularly those 50 and older, and those that are a part of the trans community?
Passage of the Equality Act will be a landmark event. I mean, as my colleague Jason said, right now, all of us are operating under this patchwork of protections where we might be protected against discrimination and have rights in one zip code, but not in another. And I think all of us can agree that your rights should not depend on your zip code. But also there's another kind of patchwork that we're operating under, which is a patchwork of what kind of place, what kind of interaction you're protected from discrimination. For example, right now, there are non-discrimination protections on public transportation if you're riding a bus or a train, but not if you're in a Lyft or an Uber. I mean, that's absurd. So the Equality Act would plug those gaps as well. And this is particularly important because public spaces are some of the areas where LGBTQ people are most harmed. Where I'm at, the National Center for Transgender Equality, we conduct the largest and most comprehensive study of transgender people's experiences. And we found that 31% of transgender people were discriminated against in a store or a restaurant in just the last year of the survey. Now, again, that's 31%. That is almost 1 out of every 3 transgender people being harassed or denied service at some kind of store or restaurant or movie theater in just the last year of the survey. So that really goes to show how high the stakes are. That's how much discrimination transgender people are facing. And the Equality Act would give us a recourse. It would make it clear in black and white terms that businesses are not allowed to do that to us. And if they do, we would be able to protect our rights and make sure to fight back.
Thank you for that, Rodrigo. Now I'd like to turn to former Houston mayor and now president and CEO of the Victory Institute, Anise Parker. Mayor Parker, can you share a little bit about your thoughts? You are a pioneer in your own right. You've been an elected official. You are a movement builder. What will the passage of the Equality Act mean for LGBTQ adults, particularly those over the age of 50?
Well, first of all, let me say, I am an AARP member. I'm going to give a plug, and I'm certainly old enough for that. But I live in Texas. I live in a state that doesn't have protections for LGBTQI individuals. I live in a city that does not have local protections, to my shame. But one of the really cool things I did earlier today was I helped cut the ribbon on something called the Law Harrington Center. It is an LGBTQ affirming independent living facility for older adults. The reason that we built the Law Harrington Center, it is the largest in the country at 112 units and one of maybe half a dozen across the United States that are LGBTQ affirming, is that too many of our seniors are living in poverty, have no access or little access to quality housing. And when they go to an independent living facility for seniors, they have to go back into the closet, or they have insufficient access to the support network that they need to navigate life. I'm proud of this center, and I'm really grateful to everybody who helped make it happen. But the reason that we're having to build centers like this is because we don't have the Equality Act to make sure that we are treated decently and fairly at every public accommodation.
Thank you for that, Mayor Parker. Now I'd like to turn to Dr. Blackstock, our resident medical expert on the panel. Dr. Blackstock, as we discuss existing disparities, health disparities in the LGBTQ community, how has the health and well-being of LGBTQ older adults, how's it been uniquely challenged during the pandemic?
So thank you so much for having me on this panel. We know that before the pandemic, there were significant health inequities with people who are LGBTQ having higher rates of chronic conditions like heart disease, diabetes, cancer, as well as higher rates of smoking and substance use. When we think about mental health, higher rates of depression, anxiety, and suicide. And just to say that these inequities don't just happen out of thin air. Many are the result of systems of oppression like transphobia, homophobia, stigma, and discrimination. We know that also LGBTQ people had, before the pandemic, were less likely to have access to healthcare, so have health coverage, were more likely to be discriminated against when accessing healthcare. And again, we're more likely to live in poverty. So when the pandemic came, it basically compounded and amplified everything. So we saw worsening challenges with accessing care. So we know that many people who are LGBTQ worked in industries such as the hospitality industry, childcare, that were most impacted by the pandemic and so lost their jobs as a result. We know when people often lose their jobs in the United States, they then often lose their health insurance. They can also, if they have health insurance, still have trouble affording care, so covering co-pays and other medical costs. We know that, for instance, the Trans Lifeline, the crisis hotline, received a lot more calls about people being unable to access care during the pandemic. And then when it comes to mental health, we know that with social distancing, there were higher rates of social isolation, depression. In a survey that Kaiser Family Foundation did, they found that LGBTQ respondents reported more likely to report worry and stress related to the pandemic, and that the stress was major. And then we also know that because, again, the industries that LGBTQ folks tend to work in is that we were more exposed to COVID-19. So all of these factors really have magnified and amplified the impact on LGBTQ communities and have impacted the health and well-being of our community as well.
And again, on the point of health and well-being, Dr. Blackstock, can you share any advice that you'd offer that might help us to support sort of the mental health among our friends and loved ones? You and I have done panels before, and we've talked a little bit about our health and well-being from the neck up and the neck down. Can you share a little bit about support for our friends and loved ones on the mental health front?
Yeah, this is such an important question because we're dealing with both individual and collective trauma from the pandemic. So something as simple as just sharing your observations with a family member or friend or colleague that you see may be struggling, saying something like, I've noticed that you seem different lately. Is everything okay? It makes me concerned hearing you talk in this way. Let me see, can I help you? And then, offering support. How can I best support you right now? Is there something I can do? Is there an appointment that I can help you make? Are there chores? Are there tasks that you need to do that I can help you with until you feel better? Would you like me to go to a support group with you? Do you need a ride to your appointments? And then just really checking in regularly, calling or texting family members or friends that we're concerned about. And then obviously, if things seem very concerning, obviously reaching out to 911 or for a medical, urgent medical or psychiatric care.
Thank you for that, Dr. Blackstock. It's now time to address your questions about the LGBTQ Equality Act and the coronavirus with Dr. Oni Blackstock, Jason E. Starr, Rodrigo Hang Lightnin, and Anise Parker. I'd now like to bring in my AARP colleague, Dr. Julie Bates, to help facilitate your calls. Welcome, Julie.
Thank you so much, Dr. Corte. I am happy to be here for this conversation. We have lots and lots of questions from those of our members who are on the phone and on Facebook and on YouTube. So the first question that I'd like to bring live for us all is Christopher in Ohio.
Hello, how are you?
Good. Please ask your question.
Okay, the question basically deals with the pandemic and how our community, the LGBT community, is responding to the disease and how many of us have been vaccinated.
Dr. Blackstock, can you share a little bit about, any numbers, any research numbers that suggest how well the LGBTQ community is faring in terms of vaccinations across the country? Any trends?
Happy to talk on this topic. So the challenge has really been that there is a lack of systematic collection of this data. I mean, there are a few states that are beginning to do this in terms of collecting data on sexual orientation and gender identity, but most states actually are not routinely collecting this data when people go to get vaccinated. So there's this issue of when you say no data, no problem. We don't know the extent to which there may be inequities that exist between the LGBT community and the general population and vaccine rates. There have been a number of surveys done where it does not appear that LGBTQ people are less likely to get the vaccine. They seem equally likely, although when we look at, for instance, Black, Indigenous, and other people of color who are LGBTQ, there does seem to be sort of less willingness to get the vaccine. And we've heard a lot about why that might be the case, driven by, experiences with the healthcare system and, in greater society. So we are trying to get a handle of that. There's a research collaborative that has just formed, including a number of LGBTQ federally qualified health centers that is trying to sort of get at what is the impact of COVID-19 on people who are LGBTQ as well as vaccinations. But the challenge is we need sort of routine collection of this data so we can have a very clear picture of whether there are inequities that exist or not.
Thank you for that, Dr. Blackstock. Dr. Bates, next question, please.
All right. I'm going to share a question from our Facebook watchers. And this question, and I'll read it to you, is I identify as non-binary. Does the government or certain governmental departments recognize a gender-neutral designation? Is this something that will be changed possibly by the Equality Act?
Rodrigo, I'd like to invite you to respond to that question, being that the National Center for Transgender Equality is a leading voice in this work.
Absolutely. This is a great question. Thank you for asking. So the good news is that an increasing number of government entities are recognizing X-gender markers. So for anyone else listening who's not aware, non-binary basically means identifying as neither a man nor a woman. And that is true for a lot of us. And so we need an option of an X gender marker on our identity document, some alternative to an M or an F. So to answer your question, over a dozen states have now implemented the X gender marker, which is really exciting. If we were doing this call just a few years ago, the number would have been 0. So we're making really rapid progress. To have over a dozen states using the X gender marker on state records is fantastic. We obviously need to bring that up to be all 50 states and territories. And then we also need to make this happen on the federal level, because even if you live in one of these states with the X gender marker, that only applies to your state documents. So things like your driver's license, but it does not apply to, say, a passport. So we gotta fix that. We gotta make it universal. At NCTE, we are working with the Biden administration to make this happen. We actually have a meeting coming up with the State Department to start adding this option of the X gender marker on federal records. It's a slow and steady process, though, and so I really encourage you to write to your elected officials at both the state and the federal level. Let them know that this is something that you care about so that they understand just how important this is.
Thank you for that, Rodrigo. Dr. Bates, next question, please.
Wonderful. I have Janice in Wilmington. Janice, please ask your question of our expert.
I want to know, my granddaughter got married in Florida to an African-American girl. In the state of Delaware, we do not recognize that. Gay people fall in love. My granddaughter has been married for 6 years, and I love her. husband or wife or whatever you want to call them. When you love your grandchildren, you love everything. So why should we discriminate any state against this? Thank you.
Thank you. Thank you for that. Jason, is there a comment that you want to share? Do you want to comment on that?
Well, first, I'm sorry to hear that you are having that experience. I can hear the distress in your voice. Now, the Supreme Court actually settled this issue a few years ago when it articulated a federal constitutional right to same-sex marriage in a case called Obergefell v. Hodges. And so I would look really skeptically at non-recognition of a marriage in Delaware that was lawfully performed in Florida. So I don't want to give you any legal advice specific to your situation in this forum, but certainly if there are issues that you or others are having with the legal recognition of marriage, certainly you can reach out to the Human Rights Campaign or sort of local organizations and state that you might be connected to. But just for folks to know out there, marriages that are lawfully performed in any state in this country are going to be recognized in any other state after that Supreme Court decision.
Thank you for that, Jason. Dr. Bates, next question, please.
Our next question comes from Sarah in New York.
Welcome, Sarah from New York. What's your question?
Yes, hi. I hope you could help me. My question here is regarding people who are in the LGBTQ community but who have other disabilities that are not necessarily cared for in health, and that they should have training for people who have more than one issue. And I've, like people who are dyslexic, or people who are autistic, or people who have psychological issues. And I feel that there's no training and no professional knowledge for these individuals who may want to avail themselves of medical help, and they really don't have individuals who are trained to help them.
Thank you for that, Ms. Sarah. I want to take that question to Dr. Blackstock. Dr. Blackstock, can you share a little bit about the state of culturally competent care in the healthcare profession, particularly when it comes to LGBTQ folks and people with disabilities, so many folks that Ms. Sarah from New York mentioned?
So I'm actually not hearing the full, I was unable to hear Sarah's full question. Was there more context to it?
So she was generally asking about culturally competent care in healthcare. And if you could talk a little bit about sort of the state of play for culturally competent care for LGBTQ folks, for folks living with disabilities, and other traditionally marginalized groups. That was the point that she was raising.
Okay, yes. No, this is such a critically important question, because we know that when many folks, LGBTQ folks with disabilities, go to seek care, they can often have very traumatizing experiences and be discriminated against. So I think, with the awareness of many of the inequities that have been amplified during the COVID pandemic, we have seen, an increase in attention to ensuring that healthcare professionals across the spectrum, nurses, nurse practitioners, physician assistants, physicians, are getting the training that they need. So for instance, I used to work at the New York City Health Department. We have trainings available. We had trainings available around LGBTQ health for clinical providers. I know that in medical schools and nursing schools, this is increasingly becoming an area of focus where students and those in training are really learning how to provide care to people who may have different backgrounds from themselves. And then we're seeing a number of, the Fenway Institute and a number of larger organizations also offer training in LGBTQ health for providers as well. So there are lots of different ways in which providers can get this training. We need to also make sure that healthcare institutions are requiring these types of trainings for providers to ensure that everyone is getting both culturally and structurally competent care.
Thank you for that, Dr. Blackstock. Julie, do we have another caller?
So our next caller is Rob in Arizona.
Rob from Arizona, what's your question?
Yes, I'm here. The question is, for those of us that are HIV positive, because there was some talk about how effective the vaccines were of immune-challenged persons, is there a test like the antibody test that would be recommended for those of us that are in that category to see whether the vaccines are effective?
Dr. Blackstock, can you talk about the efficacy of the vaccine for people living with HIV?
In general, if someone is living with HIV, but their viral load is suppressed, their T cell count, so a measure of how strong their immune system is, if that is on the higher side, there's no reason to think that the vaccine shouldn't be equally efficacious or effective in terms of preventing infection with the novel coronavirus. There is some concern with folks who are maybe substantially more immunocompromised in terms of being able to sort of fight off infection. But I think we're not seeing from the clinical trials that were done. For instance, the J&J vaccine was studied in South Africa. It had a large number of people living with HIV and appeared to be as equally efficacious in people living with HIV as those who were not living with HIV. So, unless there's some major contraindication or something that your physician has told you, the party line is that we want everyone, including people living with HIV, to get the vaccine. There's no suggestion or indication right now that people should get like a follow-up antibody test to ensure that the vaccine produced an immune response. The assumption is that it probably will.
Thank you, Dr. Blackstock.